Thank you so much, ma'am. Thank you for the kind introduction. I'll just share my slide.
I'm requesting all the speakers to just stick to time. We are behind schedule already.
Yeah,
Thank you.
yeah, sure, sir. Are my slides visible?
Yeah, please
Yes.
go ahead.
Yeah. So how to ace the theory exams is probably $1 million question that we all want to know during our residency. So first year, right, as we have joined, we all have questions like, should I buy all the books, or should I read standard books or exam oriented right from beginning? Or should I read for knowledge or for exams? Should I read every day, or should I start reading articles right from now on? So in the first year, what are the basic books which I feel you have to buy are the Parsons Diseases of the Eye, which is at least the symptomatology in the first few chapters are really good in this. Kansky's Clinical Ophthalmology, and the UG AK Khurana book which you have, it's better you just go through it once. And the Anatomy and Physiology of Eye by AK Khurana. These basic sciences books are also necessary. This doesn't mean that you need to stick on to these only books, and don't get discouraged when you start reading bigger books like Albert Jacobi and people tell you not to read such books. It's always good you read from standard books as well. So always patient is your first teacher. So more number of patients you see, the more you learn. So never don't start cribbing about going to the OPD and seeing patients. Try to do a complete workup of all the patients, at least when the time permits. And once you do the workup, discuss it with your seniors as to how the patient has presented and what are the treatment modalities you can do for that patient. And then go back and read the theory of that the same day, so that that particular case is etched in your mind. Come back the next day and start teaching your juniors. The more you teach, more and more you learn. So not only your juniors, if you have undergraduates and paramedicals, don't hesitate to take classes for them as well. For refraction, in places where most of us have optometrists now, we all lag behind this great skill. So at least in the mornings when the patient load is less, better go and start practicing your refraction. For refraction, the theory part, I feel the Duke Elder Practice of Refraction is really good book, wherein you can see the even refractive errors have been described in a story like format. But of course, it would be difficult to write for exams from this book. So for that, the Elkington is a good book. So with the various materials, start collecting them right from the first year, various notes and PPTs and articles like the DOS articles and review articles are really great materials, which so that in the last moment you don't have to sit and search for which kind of material you need to know. Start collecting them right from first year. Nowadays, there are various online resources available, like since most of the webinars are occurring online, and YouTube channels like iFocus Online are really good sources. Other than that, you have the ONE network, ICO e-learning, iWiki, the Orbis cyber site. These are also great resources. Always be proactive in your classes. Come prepared for the class. I know it would be difficult for most of the classes, but at least the important topics, and then ask doubts in class. And if the seniors or professors have asked you some questions, go back and find answers for that. Don't just leave it off there, and then the topic is always forgotten. The place where I did my post graduation, we used to have a whiteboard wherein all the questions which were unanswered were written on that whiteboard, and the next class would start only after those questions it had to be answered. Only then the class would start. Attend various quizzes which are available. Attend conferences. See, you'll have a visual memory when you attend conference, so that some few rare topics you may be able to gain through that. Try to present papers and posters as well. So you're already in your second year, and you've crossed your first year, but this would be ideal time to read various reference books like Shields or Becker Schaeffer's, Krashmer, Collins, and the NEMA. And for DNB students, the clinical trials is a short question. So it would be good if you have a handbook of clinical trials as well. So preparing notes from these reference books, it would be difficult to go back during your exams and read the whole thing. So it's always better you make up notes like this. And at the beginning of the notes, you can have an index so that at the last moment you can just go and flip to the page you want to the topic you want to. To the specialty postings, plan priorly by talking to fellows and seniors and present cases, especially those which are frequently kept for exams. investigations and interpretation of reports, and OT observations. So plan priorly by talking to the fellows or the senior residents in that particular. There are many institutes which have annual exams or the formative assessment tests for the FAT exams in the DNB institutes. Take these exams seriously, and you can also attempt for FIC or FRCS by your second year, the first part in your second year. So those of you who are already in your third year and haven't done any of these or haven't found time to do most of the things which I just told, thesis takes up a major chunk of your time in third year. So start planning and fill up your master chat right from first year, so that most of the time, I mean, it won't take most time in your third year. Then prepare question banks if you don't already have one. Make the question bank topic wise and mark the number of times the particular question has been asked. So suppose this terms conad, it's been asked 5 to 6 times. So you'll know which topic you need to concentrate on during your exams. And also you can make a short note behind it as to from where you have read that particular topic. There are various websites like the eofta.com or DNB websites or your particular university websites wherein you can ask your, I mean, if you can find the question papers. Preparing for the exams as such, there is no single golden book. There are multiple books. Each one of you might find one particular book as more interesting. Anything like Kansky, Datta, Zia Chaudhary, or Payman. You can make one of these books as your base books. Like if you're not that great in making notes like I am, you can just stick on notes from various other topics and put it on various other books and stick it onto your base book. Suppose you find a particular topic is better in some other book rather than the base book which you have kept, make that particular book as your base book and add topics onto it, and just make a note in your question bank as to where you have read that topic from. So other than that, you can make various stories and mnemonics. What I used to do is make them and stick it on the wall, especially those volatile topics, so that every day morning when I just go through them, it'll stay in your mind. One more important thing is practice diagrams. If not all of us are very artistic. So basic things like eyelid surgeries, the orbit, retina anatomy, ray diagrams, Sturm's conad, visual pathway. So these things, at least among these, at least one or two is a short in any of your theory exams. So make sure at least the common ones you practice. Group discussions are also really helpful for you to remember later on. Then revision is the key, as you all know. So coming to the day, it has come, it's a theory exam. So stay calm, carry all your stationaries like pens, color pencils, stencils, bangles, and 1 rupee coin to make those smaller circles. Try to write down as many as possible point-wise and classify properly if you have classifications in that particular answer. Have flowcharts and tables rather than writing paragraphs together, underline, and diagrams. You need not be really beautiful diagrams, but then make correct markings, and preferably with pencil and not pen, and follow the color coding for the corneal and the retinal diagrams. So this is an example of one of my residents. You can see it's actually supposed to be a ray diagram, but it's all wavy, and even this diagram, it's going right from somewhere to somewhere. We have no idea what that person is trying to show. So for ray diagrams, always use scale and pencil, and for you to be correct in that, you'll have to practice earlier. So this is one more example. You can see that there are some small circle and large circle, whether the resident is trying to show two right eyes or two left eyes, no idea. So simple thing like using a bangle to draw the circle would have made it look much better.
Ma'am is on इसमें अभी जो है इसमें है मैम. Ma'am has logged in.
Sorry.
Please mute yourself.
मैं एक बार इनको वो मैं ये वाला मैंने जो अभी पॉइंट नोट डाउन किए, तो या मैं आपको ये फोटो भेज दूं, आप उनको मैम से भेज दोगे?
Mr. Sharik,
so you just say to ma'am.
Sharik, just mute yourself, please.
Sharik, please mute yourself.
आपको वो पॉइंटर्स भेज दीजिए. So she is just prepared कि हम.
Megha, continue.
Yeah. So just by using a bangle to draw the fundus the diagram would have looked much better. So try to draw as many diagrams as possible. That doesn't mean you sit and draw a pig and a tapeworm and even the digestive tract is drawn and blood vessel and even colored it. But ultimately she's not drawn the diagram of the fundus in the toxoplasma question. So that doesn't mean you sit and waste time for all these things as well. So usually there are various patterns, but the usual pattern is of 8 questions with 180 marks. The key is time management and attempt all the questions. That's the most important thing. So you, by the first star, complete the long essays. There's a 2 20-mark questions, which is completed, and the rest don't exceed about 16 to 18 minutes. And if you feel the particular topic you want to write more, leave a page or two empty so that if you have time later on, you can come back and fill it up. So make a basic format for most questions. Like for a disease, you can make it like incidence, etiopathogenesis, then classification, then the clinical features, management in form of investigations, medical and surgical, and differential diagnosis. Like there's some format you can, so that in the exam you don't have to think what I have to write next. So everything said and done, theory exams, how much ever the best you write, the marks usually hover around the same marks. So it's always, in order to reach that notch and get the gold medal, it is better, you have to focus on the practical exam more. So 2 main books which I would suggest are FAQs and ophthalmology clinics for postgraduates. But then class notes are most important, I feel. Whenever you're attending any of the classes, write down whatever the professors or the seniors are asking, because whatever they're going to ask you in the class is the same thing what they're going to ask you in the exams as well. So ophthalmology is a lifelong learning. So exam is just one point wherein it probably to get your degree, but you'll have to learn lifelong. So for all the residents who are listening, yeah, you're welcome. And thank you to AOS YOC for this great opportunity. Thank you.